Dr. Martin Luther King Jr., Malcolm X, and Mississippi's own Medgar Evers. These were all black men that was embraced with a lot of power. Power to change the lives of black America and America itself. These men fought for the justice of black people. They fought for our civil rights. These men cleaned the path that we may have the life that we have today. Good evening. My name is Cedric Sturdevant. I'm a project coordinator with my brother's keeper. I'm also co-chair for B10 Jackson and an AAHU fellow. Today, I want to talk to you about a project from B10 that I've established called Men of Power, MOP, Cleaning the Path for Better Health and Education in the entire state of Mississippi. First, we're going to start off talking about the state of AIDS in Jackson, Mississippi, and we'll branch out a little bit in Mississippi. Jackson is the capital of Mississippi. It's also the largest city in the state of Mississippi. Now, Jackson wasn't always the capital at first. It was Natchez, Mississippi, which is kind of like southwest of Mississippi. But they wanted a central location in Mississippi to have the capital to that. So in 1944 is when Jackson became the state capital. And it was named after Andrew Jackson, who later became one of the U.S. presidents. When you're looking at the city of Jackson, you have a heavy population of blacks, about 79% versus whites, 18%. And that may be because there's we have one of the largest HBCUs, historically black universities, in the city, Jackson State University, and also most of the whites basically has moved out of the city into the suburbs area. And if you look at males, you know, there's a 46% versus females 53%, which is a higher ranking of females. Now the Jackson metropolitan area, you look at 3 counties. That's Hinds, Rankin, Madison, Simpson, and Copiah. And they're all, most of the whites in the area has moved out to the Rankin, Madison County areas. And if you come to Jackson, you basically see that. You see the big houses and all of that. Hinds County is the largest county in the Jackson metropolitan area, where Jackson is. And the large population of black lives in Hinds County as well. When you look at the income, you know, Jackson median income is like $31,000, and then look at the state's income is just $36,000, which ain't too much of a difference. And our unemployment rate now is like 12.1%. Now, when we talk about HIV/AIDS in Jackson and in Mississippi, in 2011, Mississippi was ranked number 7 with HIV/AIDS cases of 20.7 per 100,000 people. And in 2012, Mississippi reported 572 newly diagnosed cases of HIV, with Jackson having 205 cases alone in just that area. And of those, there was a very high concentration of HIV in the MSM population. Now, I don't know why Mississippi don't do this, but they don't really separate as far as race when it comes to MSM. They do separate as far as everything else, but as far as MSM, they don't separate as far as race, so I don't really know the high percentage of, I can't compare the percentage of black MSM versus white MSM, but I do know that it was it's disproportionately in the black community of MSM. Next. Now, my target population for my project, and I want you to keep thinking about Project MOP. My target population for my project is African American men who have sex with men. I'm looking at the ages of 18 to 24. I really wish that I can go lower because in the past year, the rate of infection has increased in the ages of 13 to 24. But it's very difficult to get into our school system in Mississippi. It's very difficult, even with the churches, being able to talk to MSMs. And there's a, you know, when you come to the churches, there's a very low attendance of black MSMs in the church, okay? And Of course, I said MSM are disproportionately affected by HIV. Since 2005, the number of cases among this group has increased 44%. And young men who have sex with men are also a high risk in Mississippi in 2012. And the most reported cases were those among the ages of 13 and 24, and again of 25 and 44. Now, the prevention needs for these that we have is empowerment. We look at empowerment as a way of empowering them to be happy with themselves first. Empowering them to embrace the fact that, yeah, I am a black gay man or a black same-gender loving man, and empowering them to be able to step out and be able to talk about the issues that they have, you know, with that, and not being afraid of what may come after that. And education as it relates to treatment. I think we have very little education in the state of Mississippi when it comes to treatment for HIV and AIDS. Most of the guys that I deal with, they go to the clinic and I ask them if they ask questions about this or this or this. They don't know, you know, because the doctor or the nurse practitioner or the social worker basically didn't give them that information. They just gave them enough information, okay, go take your medicine like you should. You know, they don't ask questions about anything else. What would this mean? If the side effects, what's the side effects of this medicine? They don't give them all that. So we need a lot more education surrounding treatment and care in our community. And services that address psychosocial needs. With this, there's a lot of stuff that comes with being a black gay man in the state of Mississippi. You have to hide a lot. And when I say hide, you know, they say the DL, I don't like DL, but you can't be you. You have to do what you do undercover. You know, like at Jackson State University, a lot of people from rural Mississippi come to Jackson State University. And those that have those feelings of being with another guy, that's when they come out. But yet and still they hide from their family back home. And you're looking at places to stay. Lack of food, lack of sources to get food. You know, I was talking to a young man the other day who just actually recently moved into his own apartment. And he told me he went days without food because he didn't have the money or the resources to get food. And not only that, he was off his medication. He ended up in the hospital with an irregular heartbeat and a little bit of fluid in his lungs. And because when I asked him, you know you're HIV positive, you know you're supposed to be on the medicine, what are you doing? He said, I'm giving up. Because he didn't have support and some of the resources that we need. And we're looking at that psychosocial needs that we need. In our gap analysis. Now there are services available for the target population, but you know, holistically, we're looking at very much not that many services, okay? You can go to different clinics for your health. You know, if they're going to treat you for HIV, that's all they're going to treat you for. You're not able to sit and say, hey, you know, I couldn't eat. You know, they're not asking you why you may not be on your medication or why you may not be taking your medication right. They're not asking you, do you really have a safe place to stay? They're not asking you all of that. You know, and all of that I think is a part of being healthy and taking care of yourself. You know, if you don't have a place to stay, you don't have food to eat, are you going to worry about taking medication? Are you going to even worry about getting your medication? That's going to be secondhand. And the primary target population is lack of health care services. I mean, now, the priorities for B10 Jackson, our mock project, is we want to educate. We want to do a B10 program, a workshop, where we want to educate them about treatment, about patient navigation, about disclosure, and about advocacy, our four areas up for B10. We want to increase testing. Now, we don't want to only increase testing, but we want to be able to, if we get a positive result, be able to link them to care and follow them as they're going through care. As Herman, the program that he talked about earlier, you know, that's a good program. to make sure you be there with them every step of the way. I was doing that in the past. It wasn't a part of our program. I was just doing it, me personally, to make sure they stayed in health. Got so busy and wrapped up in a whole lot of other things, I kind of fell off from that, and some of the people fell off from the care. So hopefully now that we're getting through AAHU, that I have a little bit more time, and then time to get them into the B10 project as well. Transportation. Transportation is a big issue in Mississippi because Mississippi is a rural state. If you have someone that's living in a rural area and don't have health care providers in that area that specify in HIV, then they have to come to Jackson. And by them coming to Jackson, they don't have the transportation that they need to come there. You know, a few months ago, a young man hit me up on a social media site saying he was HIV positive, but he lived about an hour and 20 minutes away from Jackson. He didn't want nobody, any of his family, to bring him to the Jackson to go to the clinic. You know, so that was the problem. So unfortunately, you know, Open Arms Healthcare Clinic, which I'll talk about later, do have a transportation system to pick up people at a certain mileage range. And that particular, well, to get him in there, I basically used my time and my gas to go get him, took him to the clinic and brought him back. So transportation is a big issue that we have, and that's something that B10 Jackson, the MOP project, hope to work on to get people into care. And better health care. Jamal just talked about educating the providers. That's something that we want to do. But, you know, personally, I feel these providers has been educated too much. They're not using it the way they should. So our focus with the MOP project is basically the community, educating them. So when they go into that doctor and letting the doctor know, hey, you work for me. So I know this stuff, I know this. So you need to tell me more than what you're giving me. And more culturally competent clinics. We have Open Arms Healthcare Clinic. It's the first LGBT clinic to open up in the state of Mississippi. You have clinics where most of the guys, they'll come back and tell us, hey, you know, we felt a certain type of way because the person at the front desk looked at us crazy if we were dressed a certain way, or looked at us crazy if we, you know, said we have sex with men, you know, or said something crazy. So we want to work on more culturally competent clinics. Basically, one of the ways that I would like to see what I would like to see happen is to get more LGBT people working in these clinics, and there'll be more next. Okay, the B10 project. We're looking at our problem statement, and Mississippi, black MSMs in Mississippi are 7 times more likely to be infected with HIV than white MSMs. And we know that this is a great disproportion, and it's like, what's going on? You know, I think Mississippi itself is focused on one area, and that's Jackson. Of course, it's the largest area. But when you just focus on Jackson, you have the Mississippi Delta, which is one of the poorest areas in the whole country. Rate of infection is increasing. And you have the Mississippi Gulf Coast, which is way on the south. Their infection is increasing. Those areas have very, very, very few services when it comes to HIV, and hardly no services when it comes to dealing with black MSMs that's living with HIV or black MSMs in general. So those are some of the areas we want to focus on. And the Mississippi State Department of Health reported that among all reported cases of HIV, men who have sex with men are the highest exposed category. In 2012, the Mississippi State Department of Health reported that the rate of among men who have sex with, well, among males was 4 times higher than that among females. And these alarming rates are due to several factors. We look at stigma, and we think, will we ever eliminate stigma? I don't think we will. But what we want to do with MOP is to educate our people on how to deal with stigma, how to face stigma. You know, face it head on and go on and do what you have to do to take care of yourself and to help take care and educate others. Homophobia. We have homophobia and we have the internal homophobia. So dealing with that, because you can't be out, you can't, you know, there's not a gay area in Jackson as it would be in possibly DC or Chicago or Dallas or Atlanta. You know, the places where most gay men frequent is the clubs at night. So we have to find out ways to deal with the homophobia. We have to create some spaces, safe spaces for the LGBT community, especially African American men who have sex with men, to go to kind of eliminate this homophobia or empower them to overcome the homophobia. Low social economic status, you know, job-wise, you know, there's hardly any jobs there in the state of Mississippi. There are more poverty-stricken areas, I think, even in Jackson, than I would have ever seen in a capital city or a major city in this country. Most of the areas, you know, you still have those, what I call back in the 60 houses that are run down, broke down, plastic over the windows, blinds are broken, and all that different stuff, yard full of trash, and people actually live there. You still have a lot of those houses in a lot of those areas. And the crime rate has kind of increased a little bit, and due to the fact of no jobs. Yeah. Lack of access to health care. We have to train and teach and talk to our guys about the Affordable Care Act. Let them know that they can get into health. When I encounter someone who's newly diagnosed with HIV, the first thing they ask is, how am I going to pay for this medication? So they don't have that education, and MOP is planning to give them that education. Drug use. Now, the most common drugs everywhere, I think, is marijuana. You know. So there's a very heavy use of marijuana, I know, in the state of Mississippi, and that's probably everywhere. But with some of those drugs, you got the ecstasy. You know, I don't know too much about drugs, but the ecstasy, I know that they use that. I'm not looking at you directly, her. But you know, you have different drugs, and then the cocaine. I have heard that cocaine is on the rise, especially in the black MSM community. So, and with that drug use, is if you don't have the money, you're gonna go solicit yourself to get that high that you want, and you're putting yourself in danger for HIV or any other STDs. And then low self-esteem. There's not very many role models, black gay men role models in Jackson or in the state of Mississippi where these young guys can look up to. You know, all they have, like I say, is the club. And if you go to the club every weekend, you see the same guys every weekend. Every weekend. You know, and that's been for years. When we do outreach, we see the same guys. Jackson has 4 gay clubs, and that's a different night for each one. Thursday, Friday, Saturday, there's a different night for each one. The other one on Saturday night is basically it's a mixed crowd. But as far as the black gay members, gay people, then there's those 3 clubs. And Thursday night you see the same people Thursday night that you will see Friday night, that you'll see Saturday night. They don't have no money, but they can get in the club. So, and as a result of these issues, African American men who have sex with men engage in risky sexual behavior in order to survive. And that's one of our biggest things. I had a young man hit me up on one of the social media sites the other week, wanted some money for sex. I was like, I don't do money for sex. But I said, however, I got a program that you can make some money from. And he came through my program. Cool. But he's soliciting, you know, well, man, I ain't got this, you know, but this is what's happening. Next. Now the goal for our project, for the MOP project, is to provide culturally relevant HIV treatment and care, science literacy for African American men who have sex with men, people living with HIV, and also healthcare professionals in the Jackson area as well as the state of Mississippi. And this is a part of our treatment education thing. And what we want to do is get that education in there, talk to them about the medication, whether you're HIV positive or not, talk how HIV affects your body and how the medication basically helps. We got a workshop coming on later this month, and we're going to touch on every area of our B10 areas. And we want to help link and retain African American men who have sex with men in Jackson and in Mississippi, live with HIV/AIDS to appropriate care for treatment through patient navigation. Mississippi don't have a patient navigation system set up. The Mississippi State Department of Health has some if I'm saying it right, caps of money. And from my understanding, they were sitting on that for 2 years. So now they're trying to create a patient navigation program, and they don't know what direction to go. So with MOP, to me, if you're going to be a patient navigation, then you need to be educated of all these areas that we want to touch on: the treatment education, disclosure, and advocacy. So when you're leading someone, being with them step by step on their treatment, if they ask you questions that they may not ask the doctor, then you will be educated enough to answer those questions and then tell them, ask your doctor as well. Lead them in the right way. And we want to serve as opinion leaders for resource advocates for African American men who have sex with men residing in Jackson and in Mississippi. We want to be able to teach our men who have sex with men to be a voice and not be afraid. We want to be able to teach them to go out and talk to their legislators, go out and talk to the city councilmen, and we want to teach them how to do it the proper way. Make sure they know what they're talking about and they're educated about it, and teach them different ways of advocacy. You know, we don't want to say, hey, you got to go lay in the street to get someone's attention. But there's different ways you can advocate. And you can advocate for yourself by being healthy and speaking out against the things that you think is wrong. And influence HIV/AIDS policy on the local level as well. And when we talk about disclosure, we want to make sure that a person is comfortable with themselves, comfortable with their surroundings, aware of their surroundings before they actually disclose their status. You know, when we talk about disclosure, we're looking at, okay, how are we going to get a person to disclose? You know, but you first have to get them to be comfortable with themselves before they disclose. You have to get them being comfortable with themselves as being a black gay man before they even disclose if they're HIV positive, before they disclose that. Because if you haven't came out, then if you're HIV positive, you're definitely not going to come out. Yeah. And you take the risk of not taking care of yourself. Next, please. And the objective of the B10 MOP program is to, by the end of the project year, increase African American MSM, people living with HIV, and healthcare professionals in the Jackson and the Mississippi area knowledge of HIV treatment education by at least 25% above the baseline through conducting brown bag luncheon presentations, workshop, webinars focused on the science of HIV. We do have a brown bag luncheon system set up in Mississippi. We're trying to get out beyond Jackson, because right now everything is centered in Jackson. And like I say, the Delta and the coast, they're getting lack of education around and everything. By the end of the project year, we want to increase the target population and knowledge of patient navigation by 25% by developing a patient navigation peer mentorship program. And when I presented this, a little bit of this to the Mississippi Planning Group. And the co-chair of the health department that's on the Mississippi Planning Group was very curious of how we would do this, create a patient navigation peer mentorship program, because like I said, they don't know what to do. In our workshop that we have later this month, the 28th, 22, through the 30th, we have someone who's been trained in patient navigation that's going to come. and do outpatient navigation piece in the workshop that we're doing. By the end of the year, project year, we want to increase the target population knowledge of disclosure by at least 25% above the baseline by incorporating disclosure of core component of all support groups. And by doing that, you know, we have to teach them when is a good time for them to disclose. It may not be safe to just be in a bunch of crowd of people and say, hey, I'm HIV positive. So we have to teach them at least the skills, the coping skills of disclosing, awareness, triggers and barriers, problem solving, and the action steps to what they need to do as far as disclosing. Next, please. And the data from the support group conducted by my brother's keeper intervention and other intervention basically shows that participants ask for more programs that focus on empowerment, treatment, and care, and how to deal with stigma. At one point, my brother's keeper had, we had movie night. Every Monday night, we did movie night for young men who was living with, not living with HIV, but young black gay men. And that program went on for like a year or two. And it was a good program because we got different guys to come out. We was able to recruit for other programs because, you know, the different people was coming out, and he gave them a place to come. Unfortunately, the building we was used became the clinic, and we didn't have the space, so that program is dropped. And in talking with some of the guys now, you know, they feel that we're not in the community like we used to be because we don't have those programs like we did. We want to bring back those programs, you know. With the mock project, we want to bring back those programs, not just in Jackson, but throughout the state of Mississippi. And providing population-specific programs that address physical, mental, and social issues can potentially have a significant impact on reducing the burden of HIV in African American male and sex with men population in Jackson and throughout the state of Mississippi. Empowering the guys, you know, to be happy with who they are. And I think they will make better decisions when it comes to their sexual behavior. Okay, next. Building the B10, okay, advancing the B10 now. Jackson was one of the first cities which B10 was launched in 2010, and I remember that because I was in that class by force. No, just kidding. But I was in that class, and it was, I thought it was hard, but now that I've been through AAHU, it really wasn't hard. But we had a good training as when we first met. Rania, Tanisha, no?
I wasn't there. In Judaica.
In Judaica. Of course, my first time meeting Phil personally. And the class was real good. And from that, B10 Jackson, the following year in 2011, we wanted to mimic what we was taught in 2010, and we traveled through 3 cities in Mississippi. We went to the Mississippi Delta, we stayed in Jackson, and we went to South Mississippi, which was Hattiesburg, and we did the B10 workshop, but we condensed it from 5 days to 3 days. Because we were looking at the retention of getting people to stay for 5 days. It was very hard. And of course, you've heard throughout the day the other B10 cities. Of course, Philadelphia and Houston was another 3 of the first cities. And all the cities that you have now that, I'm not going to name them all, because I may forget some and I don't want to hurt anybody's feelings if I forget your city. But the great cities that's among us. And now, B10 Jackson is recently being reconstructed. We are lost a lot of members. We've lost our co-chair, our first co-chair. She went on to do better things for herself, but we have a new co-chair, Linda Stringfellow, who's also the co-chair for the Mississippi HIV Planning Group, and she do a lot of things. And she is housed in the Delta. So that's a connection for the Delta, of getting up to the Delta when we want to get up to the Delta and do things. We have a membership currently now of about 17 with about maybe 10 that's very active now that comes to the meetings that we've been having lately. And the role of these members is to assess in the proposed project and implement phases and improvement. Now, I may be getting ahead of myself. I'll go next one, so I'll talk about that. Okay. Previous opportunities for B10 Jackson. Like I said, we were one of the first cities where B10 was implemented. We conducted the B10 training, the 3-day training that I was just talking about in 2011, and we participated in the International AIDS Conference in 2012, and we also did a hub from the International AIDS Conference in 2012 as well. The new structure of B10 to support the overcoming barriers that we have, collaboration will be one, and that's something that I know I'm gonna have to work on because, you know, Mississippi is kind of territorial, which they shouldn't be. We should all work together. And when we go talk to people about different projects or what you want to do, the first thing they would say, what type of money is involved. So is for me, because, you know, trying to help these guys out is personal to me, and I want to help them out, and I do some things myself that, you know, don't even have the money, but when we talk about nothing but money, then it kind of, I want to say, just pisses me off, and I kind of step away. So that's something I'm going to have to learn to do, to kind of just talk more and, you know, and actually collaborate a little bit more with other organizations, especially TBIs, and helping to support the B10 project recruitment. I know that recruitment will increase. One of the projects, we have 23 interns that's going to be a part of our B10 workshop on July 28th through the 30th. And they are housed in colleges there in Jackson. So they're going to be part of our members, and we're going to include them in our meetings, whether it be over the phone or try to get them to come to the office when we have the meetings, or set the meetings around the time that's comfortable for them as well. And then recruitment throughout the state of Mississippi. We're planning to do a workshop in the Delta. We're planning to do a workshop on the coast. And in the process of doing those workshops, we also plan to recruit members as well. Monitoring and evaluation. This is where it was a weak point of mine. Now I've learned how to do it, so I'll be better at it. And I noticed through this training, I've even looked at the project that I do with my brother's keeper, and I can actually read what's going on and know how to redirect if I need to redirect. Next. And these are our partners. Of course, my brother's keeper, who's the host organization for B10, Open Arms Healthcare Clinic, which is the newest clinic, as I mentioned, the LGBT clinic that looks at the LGBT community health holistically, not just for HIV. We have a great program for transgenders. That we have quite a few transgender males and females that come to that. We also have the PrEP and PEP set up at the clinic as well. And Building Bridges was instrumental in letting us use their office space for the B10 training that we had, the 2-day B10 training that we had. Mississippi Center for Justice is a organization that actually help people living with HIV with any kind of difficulties they have with the law. And G.A. Carmichael, which is also a family health center, which is 30 minutes outside of Jackson in Canton, Mississippi. And it's a family health center, so if you go to this clinic, people don't know what you're coming here for. They don't know if you're coming there for HIV or what. So, and versus the clinic that we have in Jackson, most people know adult special care. You go to adult special care, you have HIV or AIDS. So, next. And the B10 meeting. Now, I'm gonna talk about the 1-day meeting. You know, I forgot all about that meeting. You know, that was so long ago. But the 1-day meeting we had when we came back from the Science and Treatment last year with my employees, We talked about the origins of HIV, we talked about clinical trials, and I don't remember everything else. But in that meeting, we did a pre and post test, and I do remember there was a 90% increase of knowledge from the pre and post test from that meeting. I did it 2 days. I did 2 hours each day, so a total of 4 hours on that. Now the B10 meetings here that we had, I'm sorry I jumped to training, but the meetings, we've set the date to have a meeting the second Tuesday of every month. Unfortunately, I'm not there this month, so we're gonna have to do it when I go back to make sure we're prepared for our workshop. But we set it for the second Tuesday, which gives our co-chair a chance to be there, because like I said, she lives in the Delta, and they have the Mississippi Planning Group the second Friday of each month. So she normally comes on Thursday. So that gives her opportunity to be at the meeting, physically be at the meeting and not on the phone. The meetings are the same. Yes, we are able to integrate well with into our already formed coalition. The retention is about 50%, and what we had there at this particular meeting, there was 1 female and then 3 had sex with men, and 1 person there living with HIV. And the groups stages did not move through. What groups of stages did move through? The meeting goals, the B10 mission, the B10 for focus groups, and nomination for chairs and discussion on recruitment and monthly meeting. So we were able to get a chair for treatment education, chair for disclosure, chair for, my mind is a blank. Chair for disclosure, chair for advocacy, and chair for patient navigation. And we were also able to get a new co-chair as well. And we did, like I said, we came to an agreement on a monthly meeting the second Thursday in each month. Now the training, and I told you about the 1-day training ahead. The 2-day training that we had, these are the topics that we use for the 2-day training. HIV in Black America, HIV science and overview of the basics, treatment myth and suspicions in the Black community, treatment strategies, coalition building, mobilization, and Black America, assessing the need, monitoring and evaluation, and then we also had a brown bag lunch and the generational testing during that time. And with this, next slide, with this 2-day training, the biggest problem we had, we noticed that the biggest problem we had was lack of education due to the people that was in the crowd and some of the questions that they were asked. It was very engaging, and I had about, I want to say, roughly maybe 16 participants, and of those 16 participants, there was about 12 or 13 that was men who had sex with men, and some was living with HIV as well. Unfortunately, because I was doing this by myself and I was doing other things, I didn't do a pre or post test. And I really hate that I didn't do one. I thought about trying to, do one afterwards, but I didn't get around to doing it. So that's one thing that I learned from this training, that I really need to do a pre and post and evaluation. So on this one and on this month, there will be a pre or post and evaluation test done. A total of 16 participants, and the biggest success was the participants of Black MSMs, and the biggest challenge was finding the venue. It took me a long time because, like I said, money, funding. People wanted money for this. Next slide. And this basically a picture of the group. You see Alicia is up in the mix of it. That's some of the guys. And these are some of the bags I got from our co-chair, she's with America Vista, and know the facts about HIV, that I was able to give them the bags along with other materials that we had in the group. And this was a flyer that the Black AIDS Institute made for us, in which they would be making another one for us very soon. Process and outcome evaluation, monitoring the process. As I said before, this is one of my weaknesses. So when doing this, I really didn't know what I was doing. So at this point in time, it had not been monitored. The only action plan that we had was basically a meeting talking about what we wanted to do and how we was gonna do this. Now, for our future projects, with the B10 and the MOP project, we have, at my brother's keeper, we have an evaluation team. We actually have a whole office, nothing but just evaluation. They're all by themselves. And we call this office creep. So, yeah, it's called creep. Because they're just by themselves over there. It's so quiet. But we're planning to utilize them in our evaluation process, monitoring and evaluation process. Some of the challenges that we know that we're going to have is seeking supplementary funding for sustainability. We want this program to continue to grow. We don't want to start something and then stop. As we did the B10 training before, when we did the workshop, we did it that 1 year and we stopped. And then people was asking, when are y'all going to do the B10 training again? So we want this to continue. Utilizing MBK's evaluation team and analyzing the data, and what B10 changes are going to be implemented due to the evaluation and monitoring. We're going to try to get more MSM members. And we're not just focused on the MSM members, but we want to get them out more and more. And then reaching members outside of the city of Jackson. Some more, what are the findings of outcome monitoring? The Jackson metropolitan area and the state of Mississippi is in need of more black MSM to be working in care and treatment services, and we need peer patient navigational systems set up to guide people living with HIV through the process and care of the service. B10 recruitment and membership will be monitored through training and the monthly meeting. We'll keep up with the members by signing sheets and trying to see where our members is going. Now, when it grows and go throughout Mississippi and we start having conference calls, then we have to figure out a way how to keep up with that as well. Success, go ahead, and it's you. The success here for me was the science and treatment training. Me being a person living with HIV myself, it was very helpful, the stuff I learned on the science part of HIV in care. It made me realize, okay, yeah, because I ain't gonna lie, sometimes I would skip the medicine, but it made me, yeah, I did, John, don't look at me. But it made me realize that, hey, if I'm gonna be trying to teach this, I need to be doing this as well. So, fellowship with the fellows. I think this is the best group of people that I've had the opportunity to surround myself with. A family is not always blood, but a family is being around people that you love. You got all different attitudes, which is good. That's the way it is in a family. But a family is being around people that show you love, and you get love too. And I've learned so much from you guys, and I've had to prove it myself to some of you when it comes to liquid libation. So
lightweight.
So that's been the biggest thing for me. The Black AIDS Institute, Denisha, Rebecca, Lanisha, Rania, you guys have been there for me through this, because there has been many times it's when you leave here through the training and you go back to your job, it's like stuff that's piled up on your job, like, okay, you gotta do this, then you're like, where are you gonna find the time to do that? But you guys have been a great help with that, and I do appreciate it. And the overall AAHU training has been one of the biggest success for me. Challenge has been making the deadlines. I try not to be, but sometimes I become a last minute person. And I've learned through the different internship that when you're trying to do it last minute, you don't do your best work. So making the deadlines is basically what was some of the challenges that I have. Blogs, that's a whole nother story. We're gonna touch on it. And time. It was hard between March and May and now for me. So that timing was kind of hard because with the organization, we basically was testing almost every weekend within that time. And you know, sometimes you just don't want to do nothing but go home, relax, watch your TV, play with your dog or whatever. So time was a big issue for me. Next. In conclusion and recommendations, our next step is to meet with our evaluation quality assurance team to make amendments to the project work plan and ensure feasibility, meet with the B10 members and discuss the work plan and set deadlines for completions, and work on materials for all the training, and especially the 4 focus areas. And B10 co-chairs will set up a series of meetings over the course of the next 2 months to work to ensure all members and committee chairs are in place and they know what they're doing, they know what their roles are. And the co-chair would also work with the committees to develop culturally linguistical, I said it earlier, but I can't say it now, appropriate training material, and the B10 Jackson mock project will be in compliance in the beginning of completing tasks associated with each objective. I also would like to thank, and I don't have that on there, first the Black AIDS Institute for allowing me to attend this class. I heard about it several years before I wanted to come. I'd like to thank my brother's keeper for allowing me to come. Our ED, June Gibson, who's a very good ED, who just says, Cedric, do you. You know, as long as you take care of what we're paying you for, then, you know, do you. I also would like to thank the B10 members, the new B10 members that we have, and you know, the support from my family, my gay family, and my biological family, who has been very, very much so behind me on this. And with that being said, that's it.